The opposition DA in Limpopo has expressed concern about the outbreak of Bilharzia at the Petanenge village outside Tzaneen. The party is accusing the authorities of lacking a proper approach to safety and quality of water. 142 learners at Malwandla Primary School have tested positive for Bilharzia. Limpopo Health Department spokesperson Shikwambana joins us now to discuss this. A very good evening to you. Thank you so much for your time. The DA and, of course, parents alike are now looking to government, accusing government of lacking a proper approach to safety and the quality of water. What is your response to this?
Thank you, Paul, for inviting us, and good evening to the viewers at home. Look, I think the call by the DA might not necessarily be responded to by us, because what we effectively deal with is the response in terms of the outbreak, but also we assist in terms of awareness. But the water quality issues are issues that deals with other state organs, such as water service authorities, water boards, and district municipalities. So we do not want to get into those discussions ourselves. Suffice it to say that when we're called and told that there's a Bilharzia outbreak at the school, we quickly responded to do tests and ultimately provide medication for the infected learners.
With the tests being conducted, it doesn't mean the problem has been resolved. What is your approach to that?
Look, of course, we are clear about that fact that while awaiting the test results, particularly of water quality, we should be circumspect to the fact that there could be some more people who are infected without necessarily having to raise alarms. Because I gave an example earlier to say, if, for instance, it is found that the challenge of Bilharzia is the Richindrel River, which cuts across that particular village, it would then say more children, more people could be affected, both upstream and downstream, and also at Petanenge village. So ours is to say, once the water quality results are out and we know exactly where the source is, be able to zoom into those places that might be affected, because that is very important to us as the Department of Health in order for us to treat those who might be infected. So once the results are out, we would know this is the source and these are the places to target. But we continue to provide awareness in the area, in the greater Tzaneen area and other areas, for people to be to look out for this kind of challenges.
You acknowledge that there's a big chance that more people could be infected and affected, but what you're not talking to me about is what you're doing in the interim. Fine, tests are being run, but are you saying that there is no contingency plan?
Look, Paul, the contingency plan that we're currently running, because you should also understand that government is run in terms of legislation. So in terms of intergovernmental relations framework, there are things that we do as the Department of Health, and there are other things that are done from other institutions. And I can't sit here and speak for other institutions, but from our side, we are carrying out awareness in those areas to say, be on the lookout. We have found this particular challenge in this area, and there are possibilities that you could be, so that parents in the neighboring areas, if they see such symptoms of Bilharzia on their children, they can then take their children to the nearest facility, and also to ensure that in our facilities there is enough medication for people who would come in if indeed more and more people are infected. But also to make sure that we are ready with regards to outreaches in case where we need to go to more schools, contingent to the outcomes of the water quality results, which would inform us that we've got a bigger challenge. But so far, although we have made a call to both parents and also community members in and around areas for people to come through, we're not presenting with the symptoms of Bilharzia. So it might be under control, but like I said, everything else is still contingent to the results of the water quality tests.
Given that bilharzia is often transmitted through contact with contaminated water, you speak about creating awareness and making sure that parents monitor the potential symptoms that their children could have. What kind of awareness are you creating in terms of ensuring that perhaps there's other ways to ensure that you contain that you consume the water instead of just drinking it and having more problems and having to bring out more medication instead of just being proactive and preventing the increase in outbreaks?
We are working closely with the Water Service Authority in the area, the Mopani District Municipality, who are responsible, by the way, for the water sources in terms of testing and ensuring that the quality of water is at a proper state. So working very closely with them. Like I've said, they've already conducted tests in the water sources there, because also that people must be aware of is that bilharzia is not necessarily transmitted through ingestion like cholera. You do not necessarily need to drink the water, even if you can just come into contact with the water through bathing or washing or passing through the stream. You can still contract the disease. So hence we are working very closely with the Mopani District Municipality to ensure that while we're preaching awareness on the other side, they're also looking at the issues of infected streams or dams or lakes that might be the main source of this, because currently we're looking at two things in the area. It is the borehole water in the school, because the school does not have bulk water supply. It utilizes the borehole, and we've requested them to conduct tests. They were waiting for the results, and also the stream that cuts through the village and passes adjacent to the school, which might also be a potential source of the infection.
I'm sure you'll agree with me that prevention is better than cure, but as you and I speak, parents are up in arms. They're living in constant fear following this outbreak at local schools and calling your department to move with speed to contain this outbreak. When are you expecting those test results?
Look, also, I think the issue of parents being up in arms, as if this is only the problem of government, is going to be problematic, because also parents have a role to play in this issue. They've got a responsibility to ensure that their children do not play in those kind of areas where they could be contaminated, as much as government has a responsibility to ensure that the streams are not contaminated and so on and so on. But from the conversation that we've had with the Water Service Authority, who is responsible for the testing of water quality, we are likely going to have the results by tomorrow, so that we know exactly what is happening and be able to determine the course of action. But we also want to reiterate our call to the parents and the community to say those who are seeing symptoms, the blood like stains in the urine of their kids, they should be able to present their children to hospitals or the nearest clinics, I mean to say, so that they can get immediate treatment, but also make sure that their children play far from sources of contaminated water like rivers, streams, and so on and so on.
Very well, thank you very much. Let's perhaps leave it there. Unfortunately, we're out of time, but the conversation is a lot longer than what we have allocated for. Limpopo Health Department spokesperson Neil Shikwambana, as we keep a very close eye on the outbreak of bilharzia outside Tzaneen, where 142 learners are now testing positive for it at one school so far in terms of the information we have.